Hello, my name is Arjun Gupta and I'm a resident physician at the University of Texas Southwestern Medical Center here in Dallas, Texas. In an upcoming issue of the Mayo Clinic Proceedings, our research group is publishing an original article titled An Analysis of Ectopic Body Fat Depots and Risk of Developing Cancer, Insights from the Dallas Heart Study. Obesity, as defined by a body mass index more than 30 kilograms per meter square, is associated with an increased risk of developing certain cancers. However, body mass index by itself is not a completely representative measure of adiposity. Certain specific fat depots, such as visceral adipose tissue, subcutaneous adipose tissue, lower body fat, and liver fat, have been associated with differing impacts on cardiovascular and metabolic risk. Whether these fat depots are associated with risk of developing cancer remains unknown. We studied the relationship between these ectopic body fat depots and the risk of developing cancer in the multi-ethnic Dallas Heart Study. 2,627 individuals who had ectopic body fat measurements through MRI and DEXA scans between the years 2000 and 2002 were followed until the year 2012. Cases of cancer were identified by linking the Dallas Heart Study to the Texas Cancer Registry. Over the 12-year study period, 167 individuals developed cancer. In multivariable models adjusted for age, sex, race, smoking, alcohol use, and family history of malignancy, along with body mass index, a one standard deviation increase in visceral adipose tissue, subcutaneous adipose tissue, and liver fat was not associated with cancer risk. In contrast, one standard deviation increase in lower body fat was associated with a 31% decreased risk of developing cancer. This novel association has not been demonstrated previously, although higher levels of lower body fat have been associated with improved outcomes in cardiovascular disease and type 2 diabetes mellitus. It is hypothesized that lower body fat may act as a reservoir for excess triglyceride stores in the body, and it may also act as a reservoir for potentially lipophilic carcinogens. Further studies, including serial adipose depot assessments in a large diverse population with close follow-up for cancer, are needed to better define this relationship between these ectopic body fat depots and risk of developing cancer. Thank you for the opportunity to present this material.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.